Americans are embracing a semblance of normalcy as parts of the country continue to reopen ahead of summer. But as more adults get inoculated, experts are drawing attention to the increasing vaccine hesitancy among the young, including those now eligible to begin receiving shots. According to a study by the CDC, more than 200 children between the ages of 12 and 17 were hospitalized for COVID-19 in the first 3 months of 2021. Although none died, nearly a third were admitted to intensive care units, and roughly 5% required the use of ventilators. Dr. Dyan Hes is the founder of Gramercy Pediatrics in New York City, and she is with us now to discuss. So, doctor, help us understand why we may be seeing an increase in pediatric COVID-19 cases. I presume it has something to do with the fact that older people are being inoculated, and so the virus has to go somewhere.
Exactly. So who's left? It's going to, attack the people who are not immunized, because about two-thirds of the United States adult population is now inoculated. But remember that this data is from January to March, and the vaccine only became eligible for teenagers in May. So, there's a lag period. What nobody talks about is who are these children who are getting the virus. And I keep on saying this over and over. 75% of the children who got the virus are morbidly obese and have comorbidities in their health. So I feel like there's a lot of fear mongering out there that your kid is going to get COVID and end up in the hospital, which is really not what we're seeing.
That's important to note, Dr.
That's an
Hes.
important fact.
Yeah, it really is. So talk to us a little bit more about that. I mean, this is something I think that gets often lost in the translation when we talk about the susceptibility of young children getting coronavirus. So one of those comorbidities you already mentioned, obesity. What are some of the others?
Congenital heart disease, cancer, immunodeficiency. So anybody who had already a weakened immune system, genetic disorders. So we're not seeing healthy children dropping dead from COVID or ending up in the hospital. And I've been saying this all along. And now that we have the vaccine available, we have to do our best to encourage families to vaccinate everybody, because until we vaccinate everyone who's eligible, this is going to keep on coming back. There will, there will be new strains. And we want to get back to normalcy, but the voice of the anti-vaxxers is so strong, and there's so much misinformation out there and vaccine hesitancy. I just worry that because of these few voices who are very loud, we're never going to reach our herd immunity that we need to.
Yeah, it's so good to sort of put into focus really what the risk is, not only for kids who are healthy and they're not as much at risk, but the other kids need to know keep wearing those masks, keep social distancing, make sure you're sort of not in places that are really crowded because you're particularly vulnerable. Some experts are also warning of a lag in vaccinations among teens, and that lag may delay full U.S. Return to normalcy. Do you think that could be the case? How important is it for teens to also be vaccinated?
Well, I think of teens as small adults in this scenario, because my patients who have been teenagers who've had COVID might have been sick for 2 or 3 days, as opposed to my 2 or 3-year-old patients who had COVID who really had nothing. Teenagers, the risk of suicide, depression, loneliness, all those things are much more severe in adolescents than the COVID virus. And that's what we're seeing huge amounts of. I had a patient yesterday who hasn't gone to school since last year, and the parents couldn't opt back in their school district. When it reopened in hybrid, they said, no, we're too full. You can't opt back in. This child is 9. He is so lonely. He hasn't seen anybody. And, he has sensory disorder. He has autism, so he doesn't tolerate the mask well. So, basically, he's all alone. We need to vaccinate everybody for the few who can't tolerate masks, for the few who can't take the vaccine. And I am just waiting for the day that it is FDA approved. And honestly, in 1905, there was a landmark Supreme Court case in Boston where they mandated the smallpox vaccine. And if you didn't get it, you got fined. And it was held up again in 1922 in Supreme Court. And I think that might have to happen with the COVID vaccine.
You know what's really interesting, Dr. Hes? I've heard some people say, looks like the numbers and the majority of the people who aren't getting vaccinated are in southern states. I'm here in the Northeast. I'm vaccinated. My family's vaccinated. My teens are vaccinated. So, you know what? I'm protected. I'm good to go. And I can't help people who refuse to understand the science or who refuse to, be educated about the misinformation that they may be receiving. Talk to our viewers why that is probably not a good way to think about this, specifically because you mentioned these variants and that we could find ourselves back in a situation that we don't want to be 6 months down the line.
Exactly. And we want our kids to be able to take their masks off in school and learn properly, but we can't do that till everybody is on the same page. And I'll just give you an example. My daughter is going to a sleepaway camp where every camper, they're over 13, is vaccinated, but one staff member is not vaccinated. So for that reason, all the kids have to wear a mask for the first week of camp until they have 2 negative COVID tests. How does that's a collective punishment for all those teenagers who took the vaccine. So there has to be some sense of normalcy. We have to think about public health and why we do it. I get the flu vaccine every year because I don't want an elderly person to catch flu from me. And that's how we have to think about the COVID vaccine. We have to do it because we have to stop the spread everywhere. And as travel is increasing, people are going to bring in different variants, and we're going to go other places and bring variants if we're not vaccinated, and they're going to come back to the U.S. I really think that it should be mandated that anybody who's entering the U.S. has the vaccine, which is not mandated right now. I think we have to change our public health law, and I think we have to do a better job getting the word out to vaccinate teenagers as best we can and put the vaccines in pediatricians' offices. That's where they need to be, and they're not in the offices. And the government should subsidize that Pfizer freezer that costs $15,000 and put it in pediatricians' offices, and then we will get the job done.
An important note. Dr. Hes, thank you as always. We appreciate it.
Thank you.